Hello, and welcome to the 8 Essential Elements for Strong Public Health Policy, presented by Public Health Law and Policy. This is Ian McLaughlin, and for the next hour or so, we're going to be talking about creating sustainable, strong public health policies, focusing on 8 essential elements that we've identified and fleshed out a little bit. The fact that we're having this conversation at all is really actually very significant and shows that we're really in the middle of a seismic shift in our approach to public health. Policy work is nothing new, but the recent focus on policies to affect public health really is a shift in the way that we think about it. It doesn't matter whether you're working in tobacco control, nutrition policies, physical activities, or policies to reduce chronic disease more generally. Whatever you're working on, policy has proven now to be an effective solution. This webinar is brought to you by Public Health Law and Policy. We're located in Oakland, California. And we're a team of attorneys, urban planners, policy professionals, and a lot of us have a background in public health as well, specifically. And we partner with state and local leaders to use policy approaches to improve public health, especially for the underserved. We do this by researching legal and policy questions and creating model policies, and really helping train community leaders to put these ideas to work in their communities. As I said, this is Ian McLaughlin, and I'll be joined on today's webinar by Catherine Mungin, my colleague here at PHLP. Here's a brief agenda about what we're going to be covering during today's webinar. And although the agenda looks very simple, it really is going to be packed with a lot of information. The first item on the agenda today will be defining the problem. And in doing any type of policy work, defining the problem really is critical to ensuring that you're going to have a successful policy. It's defining the problem in a way that actually can be addressed through policy, and that is looking at the places where we live, we work, we play, the places we exist in every day, and seeing how those can be improved in order to be more conducive to public health. It's really with an eye towards prevention, defining the problem in a way that can be addressed through a preventative policy. Somebody who already is suffering from a chronic disease, for example, will receive probably little help from a policy at this point. It's really aimed at prevention. And then once the problem is defined adequately, the bulk of this webinar is actually going to focus on number 2, which is finding policy solutions that work. And it really is creating policy solutions that work. Again, I said that we would be looking at 8 elements for strong public health policies during this webinar. And those 8 elements are not unique to any one subject matter area. There's policy solutions that obviously can work in tobacco control and obesity prevention, chronic disease, and a number of different areas. But the 8 elements that we've identified and are going to be talking about during this webinar really cut across all of those areas and are essential no matter what kind of policy you're working on. So that will be the bulk of our webinar today. And then finally, the third thing we'll talk about briefly is locating some resources to help in your policy work. And we have a number of resources here at Public Health Law and Policy, and we'll be highlighting some of those at the end.
Thanks, Ian. So my name is Catherine Mungin. And as Ian said, before you can find a solution, you have to understand the problem. So in tobacco control, at least, this is how we've traditionally thought about the problem. Smoking rates have been high, and it was common to see people smoking in all different kinds of areas. It used to be that people wouldn't think twice about lighting up a cigarette in an office meeting, but now you're more likely to see people outside the office smoking, or smoking outside of a bar and not inside, or even designated smoking areas. The norm is that buildings are becoming smoke-free. So what drove this social norm change? Well, I really like this graph because it really illustrates the consequences of policy. Here we can see smoking rates over time. And you can see that in the beginning of the 1900s, smoking rates were increasing with a short dip during the Great Depression. And then at the start of World War II, you really see the unintended consequences of a policy of providing cigarettes in the mess kits of soldiers. At that point, smoking rates increased dramatically as an entire generation of men really became addicted to cigarettes. And brought that home with their families. And that increase continues until the first Surgeon General's report, which is really when a period of education came in. And that education period prompted policy changes, which you can see with the first broadcast ad ban that prohibited cigarette advertisements from being on TV or radio. And then later on we see the federal cigarette tax doubles. And this is when smoking rates really have a steep decline. And what's not represented on this graph is that during that period after the 1990s, that's when a lot of states started passing smoke-free policies as well, which really changed the environment. So, I mean, as you can see, tobacco use and smoking rates have been decreasing, but they're still high, and there are new products like e-cigarettes or flavored little cigars and snus that pose new challenges. We're also learning more about new science, like third-hand smoke and how those can affect us in new areas. So the good news is that we can learn from our successes, and we can also apply these successes in other areas, like obesity prevention. This photo really represents government decision-making in land use, transportation, and housing policies that really drive the health outcomes in our communities. We know that communities with a lot of liquor stores and convenience stores have less access to healthy foods. We also know that a street like this one discourages walking, it discourages cycling, and it even discourages the use of public transportation, and it forces us into our cars. And these all contribute to the obesity epidemic. So what's the goal? It's really to change the environment around us so that we can make better choices. And the question is, how do we do that?
Well, if the question is what's going to change the environment, and that's the problem, the solution is policy in this case. And we're really talking about local policy solutions. Although state laws and federal laws can really have a big impact and affect a lot of people, a lot of the innovative public health work in policy has really happened at the local level. At Public Health Law and Policy, we've been working on public health policy solutions for about 15 years now, and we started off in tobacco control. And a little later in the presentation, we'll talk a little bit about some of the tobacco control policies we've been working on, especially in California, and how enormously successful those have been. Whether you're talking about creating smoke-free areas, or smoke-free multi-unit housing, or reducing youth access to tobacco, local policy approaches in tobacco control in California have really turned the tide in tobacco throughout the entire state. Well, as we began working on obesity prevention policies a little bit more recently than that, we tried to take a step back from our tobacco control work and look at it and identify, of the tobacco control policies that have been so enormously successful in California, what are some of the common elements of those, and what are some of the things that we can really import and extrapolate into the obesity prevention movement? Well, that yielded some really interesting results, and that's how we came up with these 8 elements. Again, it doesn't matter whether you're working in tobacco control or obesity prevention. These are 8 elements that really cut across any policy, and especially any public health policy, to ensure that it's going to be successful. And I'll run through them. We're going to be talking about each one of these 8 now in more detail. But the first is that it is a policy and not a program. Programs in public health have been enormously successful as well and complement policy work. But we're talking about policies here. The second item is that it has to be legally feasible. I'll talk more about that in a moment. The third element is that it's really data and context driven. The fourth is that you can really have a clear idea about how it's going to be implemented and some accountability as well. The fifth, and I noted this before, is that public health really needs to focus on the underserved, and the policy should account for disparities. The sixth is that it also should be financially sustainable, especially in these hard economic times. The seventh element, changing the conversation. This is really focusing on a new way to look at public health, and especially public health through policy. And then finally, the eighth element is that nothing can be looked at in a vacuum. Any policy has to be part of a larger overall plan. So that's a roadmap of the 8 elements we're going to be talking about, and again, they're widely applicable. But let's talk about each one of these in a little bit more detail.
So element number one, it's a policy, not a program. You might be thinking element number one of a strong policy is that it's a policy. Well, it's important that we talk about what we mean by policy because we use the word policy in a lot of different senses. So in this context, what do we mean by a policy? Well, a policy is a statement in writing that's binding so you can enforce it, and it sets out a general approach to be applied broadly. So you might be thinking, well, that sounds a lot like a law, and you're right. We probably all remember how a bill becomes a law, and a law is one kind of policy. But there are other examples of policies that meet these criteria. So we do have federal laws that are passed by Congress, but also federal regulations that could be passed by or that could be issued by an agency like the FDA. There's state laws and then local ordinances that are passed by city or county governments. We also have resolutions, zoning language, contracts, or school board policies. And these all have these three elements in common, that they're written statements that are binding and enforceable and are applied broadly to everyone. So when you think of a policy, the easiest thing to do is to think of a law, like a smoke-free law, and contrast that with a program, like, for example, a cessation program that could provide support to people who want to quit smoking. And the idea is that these policies, like smoke-free laws, really create an environment where programs like cessation programs can flourish because they increase the demand or make it easier for programs to be created and be successful. So what are the benefits of focusing on a policy and not a program? Well, first, a policy allows for accountability and enforcement. And the accountability comes from the fact that it's passed through a democratic process. So you do have stakeholder input, or at least you have areas where people can provide input. Another benefit is that a policy reaches more people because it applies to everybody in that jurisdiction. So a state law would apply statewide, while a local ordinance would apply to everyone in the city. A policy also institutionalizes good ideas, and what that means is it's harder to dismantle a policy once it's been enacted because you have to go through the democratic process again, whereas a program could be cut because of funding losses or because of new political administration. So to illustrate this with some of these photos, there are a lot of programs now that promote landlords converting rental units into smoke-free units. And this is great in the sense that it creates smoke-free housing where it didn't exist before. But a landlord could change this, or it would obviously only apply to the properties that the landlord owned, whereas a smoke-free housing policy could apply across the board and have renters in an entire city benefit from this. The next benefit is that a policy really allows for consistent implementation. Looking back at that last example, a landlord could decide to enforce or implement their smoke-free policy in any way that they choose if it's a voluntary policy that they created on their own, whereas a law would be implemented by city staff in some way, and it would be consistent across all units in the entire jurisdiction. And in that way, it really establishes these relationships and responsibilities amongst people. So these are the benefits that we think of when we think of policy options. I just want to give you one more example of how a policy can be quite powerful. So this is Fresno, California, where we actually grow a lot of the produce that feeds most of America. And a lot of the population actually works in the agricultural industry. And yet they had very little access to fruits and vegetables. Well, why was this? Well, something that somebody noticed was one reason was that farmers markets and produce stands actually weren't written into the zoning code. So they weren't permissible uses. That is, they weren't even allowed to exist under the current zoning code. So Fresno could have done a lot of things to address the lack of fruits and vegetables. It could have created programs that increased access or brought in these kinds of food sources. But instead what happened was they actually amended the zoning code to define farmers markets and have them be permissible uses. And this allowed a variety of farmers markets and produce stands and businesses to pop up. And it also allowed other programs like SNAP, the Supplemental Nutritional Assistance Program, to flourish and create incentives for people to use those benefits at farmers markets. So this is just one example that illustrates how a policy change can really create an environment that allows programs to flourish in a very positive way.
Now let's talk about element number 2, legal feasibility. Your policy must be legally feasible in order to be successful. And when we talk about legal feasibility, we're really talking about 2 distinct areas. There are a few more, but these are the 2 that I really want to focus on. And one is, does your jurisdiction, whether you are at the local level, a city or a county, or the state, have the legal authority to adopt the kind of policy that you want to adopt? And then even if you do, we have to go to the second layer, which is the constitutional restrictions. Even if you have the authority to adopt the kind of policy that you want to adopt, the Constitution does protect some basic rights for everybody in the nation, and sometimes those rights also restrict what kind of policies you can adopt. And I've listed a few here: the right to free speech, due process, equal protection, and takings. And those are some of the ones that are most commonly implicated by the legal rights that are most commonly implicated by public health policies. I do want to note that oftentimes the legal feasibility of a policy can be a red herring. That is, you might hear from your city attorney or your state lawyers, we can't do that because that's just not legal. But I really want to separate out legal feasibility and political feasibility. And this is where it's really important to involve attorneys in the policymaking process. I mentioned that public health law and policy, a lot of us are attorneys, and we provide a lot of TA both in California and throughout the country on different public health policies, and we're able to help work through some of these legal issues. If you hear, we can't do that because it's not legal, I wouldn't let the conversation end there. I would engage some legal TA, whether it's from us or some other attorneys, to determine, are the legal issues really insurmountable, or is that really a red herring because for some reason there's not the political will to pass the policy? But let's talk more about legal issues, and let's start with the legal authority for public health policies. The legal authority for almost every law that you see around you is what we call the police power. Well, what do you mean by the police power? I'll admit that for several years of my life, the band The Police exerted an enormous amount of power over me personally, and I'm still trying to locate all of the visual evidence of that period of my life and burn it because it's not happy. But that's not what we're talking about here. When we're talking about the police power, we're talking about the power of government to enact and enforce laws that promote the public health, safety, and welfare. That's very broad, and the police power itself is very broad. The police power exists at both the state and the local level. The federal government only has the power to enact laws that are delegated to the United States government by the federal Constitution. All other power to govern is left to the states, and that is in the federal Constitution. So that delegation of all the remaining power, the reservation of power to the states by the federal Constitution, constitutes the state's police power. So as you can see there, that's very broad. The powers of the United States government are limited to those that are specifically listed in the Constitution, and everything else is left to the states. But local governments also have police power authority. And in California, the California Constitution has delegated police power authority to local governments very broadly as well. Here's a phrase from our California Constitution that basically says that any law that is not in conflict with a state or federal law may be enacted by a city or county. So that's very broad itself. Other states don't have quite as broad police powers, but many do. And so when you're looking to operate at the local level and enact a policy, one of the first questions you have to be aware of, and one of the first answers you have to have, is what kind of local authority do we have to enact these kinds of laws? In California, as I say, luckily it's very broad. There are a few limitations on the police power in California, but the main one is that there has to be a rational relationship between the law that you want to adopt, the policy that you want to adopt, and the problem to be addressed. It's actually a very low standard that oftentimes is analogized to a smell test. Does the law pass the smell test? As I said, unless there's a constitutional issue involved, this is a very low standard and the police powers are very broad. And more so, if a court is hearing a challenge to a law that was enacted pursuant to the police power or really pursuant to any other government power, the courts give great deference to the legislative findings of a need for the law. So you want to include some legislative findings if you can, but basically the fact that the legislative body has acted to adopt a policy, the courts will give that great deference. So all that's to say that there is very broad police power. And we see examples of police power all around us every day. Everybody is familiar with signs in restrooms, for example, requiring that employees, and especially employees in restaurants and other establishments where food is handled, must wash their hands. Speed limits and reduced speed limits in school zones and construction zones, another use of the police power. And in public health, tobacco control, obesity prevention, almost every one of our laws, our policies, are a result of the police power. This is just one example, banning cigarette sales near schools, but restricting sales to minors, secondhand smoke laws, those are all examples of the police power. So the first question under legal feasibility is our police power broad enough to enact this kind of law? And the second question is, even if we have the police power, is there another issue of preemption? What is preemption? Well, to put it simply, preemption is the invalidation of a local law by a state law or the invalidation of a state and local law by a federal law. Preemption stems from the Supremacy Clause of the United States Constitution, which basically says that federal law is the supreme law of the land. And using that as a guide, a higher level of government can essentially prohibit a lower level of government from enacting a law on the same topic that the higher level has acted on. Now that's a mouthful, but let me give you some examples of what we mean by preemption. There are really two types of preemption, ceiling preemption and floor preemption. And let's talk about ceiling preemption first, because I think this is generally what people mean when they talk about preemption. And let me use a federal law, a hypothetical federal law, as an example. Ceiling preemption would occur if a federal law prohibits states and localities from passing different, stronger, or broader laws. The idea here is that the federal law is the supreme law in this case and fills up the entire room up to the ceiling, leaving no room for state or local laws on the same topic. There are many examples of this that I think you'd be familiar with. Think about buying packaged food, and every packaged food has a nutrition facts panel on the back. And in every state, that nutrition facts panel looks exactly the same. It lists the amount of fat, calories, servings, and whatnot in that packaged food. Well, the nutrition facts panel is mandated by federal law, and that federal law preempts any state or local government from enacting a different kind of nutrition facts panel requirement on their own. So every state that you go to, you'll see the same nutrition facts panel on your food because states and local governments are preempted by the federal law from enacting a different nutrition facts panel. The other type of preemption, which some people conceptually would not even call preemption, is floor preemption. And floor preemption occurs, let's take another federal law hypothetical. Floor preemption occurs when a federal law sets a minimum standard or a floor and leaves rooms for states and localities to adopt stronger standards. For example, federal law sets a minimum wage for hourly employees, but states and local governments can go beyond that federal minimum wage and enact higher minimum wages, and in fact, many states and many localities have done that. This is an example of a federal law setting a minimum standard that applies across the entire country, but allowing room for states and local governments to go further. What are some of the advantages and disadvantages of each? Well, ceiling preemption, which is typically what we think about when we think about preemption, covers a wide range of people because it covers the entire jurisdiction, whether it's a federal law covering the entire nation or a state law covering the entire state, and it provides uniform standards for all of those people who are covered by the law. In some ways, it's actually more efficient because going back to the nutrition facts panel example, no matter what state you're in, you are familiar with what the nutrition facts panel looks like, and so it's efficient use of that information. It also allows for equal treatment of everybody covered by the law. Say, for example, you do a lot of airline flying. Another good example of ceiling preemption from the federal law is that there are the same air traffic safety laws in every state. That is, when a pilot is flying from California to New Jersey, there isn't a separate air traffic safety law that they have to adhere to when they get to New Jersey. There's one law that applies throughout the entire United States, and that promotes safety as well. Floor preemption, which allows for states and localities to actually enact stronger laws than the floor preemption law itself, are really important in public health, and a lot of the public health innovation has come at the local level, and since floor preemption allows for state and local action, this is very important for public health. There's more flexibility, more innovation, and more progress in local laws, and as I said, a lot of the innovation in public health has come at the local level. In California, for example, most of the state tobacco control laws, and as well as the federal FDA tobacco control law, allow for states and local governments to go even further and enact stronger laws. So in some ways we have it almost the best of both worlds in California in tobacco control. We have some state laws that are very strong and cover the entire state, but for localities that want to go further and enact stronger laws, they are allowed to do so. So that's a little bit on the legal authority, and now I just want to touch for a moment on constitutional restrictions, because as I said, even if you have the authority and you're not preempted, and therefore you can move ahead on a policy, you can't enact a policy that infringes unduly on somebody's individual rights. I listed some of the individual rights on the first slide of this element: the right to free speech, the right to fair procedures, the right to security in your property, the right to privacy is another one. And constitutional restrictions really are a matter of balancing those constitutional rights versus the public health concern that should be addressed by the policy. Here's one example that comes up almost every day in our work, and that is, how can we limit advertising of harmful products, especially near schools? Whether you're talking about tobacco advertising, junk food advertising, or sugar-sweetened beverage advertising. A lot of public health advocates want to do something about this, but it's tremendously difficult, and that's due to the First Amendment, which provides commercial entities the right to protection in their advertising and promotion of their products. So we couldn't just necessarily say you cannot advertise Big Macs near a school, or you couldn't advertise sugar-sweetened beverages near a school, because it's a matter of balancing the company's commercial speech rights to engage in promotion of their lawful products versus the public health danger of having those promotions and advertisements near schools. That's just one example that comes up all the time, but the examples are numerous that sometimes individual rights will restrict what you can do in terms of a public health policy. So when you talk about legal feasibility, it is really a two-step inquiry. What is our authority? And then is there a constitutional restriction that is in play here?
Element 3, it's data and context driven. So when we work with communities, often our first step is to ask the community to identify and describe the problem that they want to address. And it's important because any policy solution should really be driven by this context of what is the problem, what's the issue. And it can be made stronger when there's data to support not only that issue's existence, but the policy solutions that you're proposing. So one example is sales of tobacco to kids, which is obviously illegal, and yet it still occurs. This is a problem in communities all across the nation, and in California, a lot of communities have decided to take steps to address this on a local level. So communities in California knew it was a problem because we've collected data on youth purchase rates, which is basically just the rate at which kids can illegally buy cigarettes. And the California data shows that youth purchase rates are actually quite high. And yet, California's statewide data may not be reflective of the local youth purchase rates in a community. So it's important for cities and counties to go out and collect this data too to see if their rates are higher or could be higher for different kinds of products. And one policy solution that's come out of this is local tobacco retailer licensing, which is basically a system that requires a tobacco retailer to get a type of business license, a tobacco retailer license, in exchange for a licensing fee. And this licensing fee goes to fund enforcement. And these enforcement operations have actually been shown to be really effective at reducing the illegal sales rate. So the Center for Tobacco Organizing and Policy, the Center for Tobacco Policy and Organizing, has actually put together some information on how these have been effective. They looked at some of the communities in California that have passed strong tobacco retailer licensing ordinances with annual fees that fund enforcement, and they look at the youth sales rate before and after. And in every single instance, the data shows that youth sales rate went down after the ordinance was passed. So this is really an example of not only how this data collected before the ordinances provides support for why this policy was needed, but also collecting data after implementation provides support for how the policy is working and has encouraged other communities to pass similar policies, to the point where now we have over 100 communities in California which have this policy because of its dramatic success. And I really want to emphasize that local policymakers respond to local data. I think we're all drawn to fancy national statistics from think tanks or widely known universities, and those can be really helpful, but that doesn't preclude you from going around and collecting your own data, even if it's low tech. One example I know of is in Louisville, Kentucky. They really wanted to create a pedestrian policy to address this problem that they had with really low walkability scores, in the sense that it was hard to walk around the community. So what city staff in Louisville did was they did surveys with pedestrians and other citizens to figure out what the issues were and where the problems were. And beyond that, city staff actually went out on walks with pedestrians to see where the policy should prioritize infrastructure, other issues. So this is one example about how low-tech data gathering at the local level could really make a policy stronger than it would have been otherwise.
Now let's go to element number 4, and that is the policy's implementation must be clear and accountable. A law is really just words on a paper, but those words are intended to spur action and actually require different actions of different persons, and so you have to be very clear in those words about what's required by the law. One of the challenges to some laws is that it's void for vagueness, and that means those persons who are required to do something by the law don't know what they're supposed to do because the law is not clear enough for them to really do anything. The flip side of that is you want to include some accountability. That is, you want to set clear standards in the law for what people subject to the law have to do so that you can hold them accountable if it's not done. Let me give you a couple of examples. The first is in the context of complete streets. And complete streets is the policy basically that requires land use and transportation planning to include all users of streets, to create pedestrian and bicycle pathways, public transit, as well as uses for automobiles. There are a lot of communities that are tremendously interested in incorporating complete streets policies in their community. And in fact, many of these communities have amended their general plans to require complete streets planning when future streets are developed. A general plan is sort of like a guiding document for a city or a county. It sets forth the policy to be followed by the county for the next 10 or 20 years or whatever period of time, and it has to be referred back to when the legislative body is looking at different laws. Does this comply with the general plan? So as I said, a lot of communities have incorporated complete streets type language into their general plan. Here's one example of what that language might look like, and this is taken from one of the first general plans we reviewed many years ago on complete streets. It says the city shall seek to facilitate and encourage the use of public rights-of-way by pedestrians and bicyclists, and shall strive to reduce traffic and improve public health and safety. Well, that's pretty good language, but it says that the city shall seek to facilitate and encourage, and I'm not really sure what that means. So compare it to this language. I'll give you a moment to read this language. I think you'd agree that this is much stronger. This actually requires the city to do some concrete things. Establish a steering committee, develop a complete streets policy, implement the policy, and propose complete streets legislation. So this shows one thing that I was talking about, which is that it's important to be very specific and concrete with which duties are required under the law if you really want to have meaningful action. Let's look at another example from tobacco control, and that is tobacco retailer licensing, which Catherine just touched on about being hugely effective in reducing sales to minors. Well, in addition to being hugely effective, local tobacco retailer licensing laws also require a great deal of enforcement and implementation by many different agencies of the government. So here's one way you might set forth the duties to enforce a tobacco retailer licensing ordinance, and I'll give you a moment to read it. Well, you'll see that the second line says the city anticipates that compliance checks will be conducted periodically, and it gives the city generally the duty to monitor compliance with the law. Compare that with this policy language. Again, I think that you would agree that this is much stronger and will probably yield much better enforcement and implementation of the tobacco retailer licensing policy. It designates exactly which department shall do the enforcement. It gives them an affirmative duty to check the compliance of each tobacco retailer a certain number of specific times, 3 times per year, and it gives guidance on what exactly those compliance checks should look for. Those are 2 very quick examples, but I can't underscore the importance of these points enough. That is, if you really want your policy to work, if you want to build in some accountability and you want to make sure that it's going to be enforceable and able to be implemented, it's very important to be very clear with what is required and of whom in the law.
Element 5, it accounts for disparities. So I think this element is really important. And that's because I come to public health from really a passion for social justice, as I think many public health advocates do. And what this element does is it reminds us to look at our public health policy through a social justice lens. So what we know is that low-income populations and communities of color have higher rates of smoking. They have higher obesity rates, and they suffer disproportionately from chronic diseases and other illnesses. So how do we take this into account and make sure that our policies are addressing these disparities in a way that promotes equity? Well, one example of how this has been done is in South Los Angeles, where they really address disparities head on. This is what the food environment in South Los Angeles looks like. There were a lot of fast food restaurants, and there were very few places where you could get healthy food. Few grocery stores, few farmers markets, if any. And they wanted to do something about it. So they actually created a moratorium on new fast food restaurants in this neighborhood. And this was coupled with some incentives to try to encourage healthy food retailers to move into the area. Now, policies like this can be kind of controversial, and a common criticism is that they're paternalistic. Why would you go into a community and tell them what they can and can't eat? But what LA did in this example is there are actually a lot of local health advocacy organizations like Community Health Council and others that were working with community members in this neighborhood and getting their input. And the stakeholder input is really important. And by the time this got to City Council, they actually had a lot of support from the local community. And what this did was it really undermined any arguments of paternalism because the community itself was advocating for this policy. One more example of how you can address disparities is by looking at a product or an issue that disproportionately affects low-income communities or communities of color. Here we have little cigars, and again, in a Los Angeles suburb, people were noticing that these little cigars were aggressively marketed to urban youth and also to communities of color. And you can see here they're placed right by the candy. If you're not familiar with them, you might not even notice that they're not candy. In the black and mild containers and the pink-colored wrappers, those are little cigars. So what are little cigars? Well, they look a whole lot like cigarettes. They were actually designed to be as close to cigarettes as possible without meeting the legal definition because they didn't want to follow any of the restrictions that are placed on cigarettes. For example, cigarettes can no longer be flavored with the exception of menthol, but you can't have cherry-flavored cigarettes. You can, however, have flavored little cigars. So right here on the right you see Swisher Sweets in strawberry flavor. And there's a lot of evidence showing that these really make it easier for people to start smoking because the flavor cuts the tobacco taste. Another example is here on the left. It's illegal to break apart a package of cigarettes and sell them individually. There's a lot of reasons for this, including the taxes that we have on cigarettes. But little cigars aren't subject to these taxes, and it's actually perfectly legal to sell single cigars in most places. And these are sold for under $1, which makes them extremely accessible to not only kids, but people with low incomes. And what it does is it increases their access to addiction. So Los Angeles really wanted to address this, and like some other communities in the country, they did this through a restriction on the sale of little cigars, so that little cigars really had to be sold in the same way that cigarettes were, in packages. And this is one way to counteract that predatory marketing that's going on from the tobacco industry and make this product that's really similar to cigarettes be more similarly regulated. So I can't stress enough how important it is to kind of keep health disparities in mind as we're thinking about the policies we're promoting. And if you have a policy that maybe on its face doesn't seem to promote health equity, think of ways in which you could maybe tweak it so that it did.
Let's move on to element number 6 now, which is the policy must be financially sustainable. In a perfect world, all policies would be financially sustainable, but that's not always the case. And I can't tell you the number of times I've heard from communities, well, we just can't do that because that's going to cost money, and we have no more funds for any enforcement or implementation of this policy. The police department is already on overtime. Other departments are being cut. So we just have no personnel and no funds for this policy. So in this particular era, financial sustainability of a policy is even more important. So what do I mean by financial sustainability? Well, I don't mean that you find a grant or an award of money or take money from the general fund to enforce a policy or implement a policy, although those are all great. So this is a way to complement those traditional sources of funding. And if you have funding in the general fund, or you're able to find a block grant or something to fund enforcement, that's fantastic. But in this context, we're actually focusing on the policies themselves and whether they are inherently financially sustainable. And that is 4 things. Either it's low cost or no cost to implement, or the policy uses existing funding, it actually saves money that can be used for other purposes, or generates its own revenue. Let's look at each of these one at a time. And the first is, what's a low or no cost policy? When public health law and policy started doing obesity prevention work a number of years ago across the nation, one thing we noted right away is that many school facilities were actually locked up during non-school hours and on the weekends. That is, the community couldn't go and use the playgrounds and the courts and the fields for any recreational activity at all. They were completely locked, and you had to actually climb over the fence if you wanted to use them. At the same time, there's a dearth of actual park access in so many communities, and there's no places to play. So it seems like a very easy marriage to put these two together into a policy, and that's what we've done. Joint use policies, joint use agreements are policies that can be entered into between a school district and a government that essentially allows for the opening of school facilities after hours for use by the community. The primary issue with joint use agreements that we found was a fear of liability, which in most cases turned out to be completely unfounded. And now joint use agreements are really cropping up almost everywhere, and more school facilities are being opened. So this is a great way to actually automatically increase the amount of park space and play area and area generally for physical activity in a community without having to construct anything new. These facilities are already constructed, and it's just a matter of opening them up. So that's really a low or no cost policy. Another way to have a financially sustainable policy is to use existing funding in a new way. Let me give one example from the state of Oklahoma. Oklahoma has had one of the highest adult obesity rates in the entire country, and 80% of Oklahoma children don't eat the recommended amount of fruits and vegetables daily. The Department of Health in Oklahoma actually classified more than half the state as a food desert, which is a term used to describe an area that has no adequate food retail. So really, there's a high obesity rate, yet most kids are not eating enough fruits and vegetables, and there's not any good produce or staple foods to buy in over half of the state. At the same time, Oklahoma had a state agricultural loan program that was available to farmers to provide low-interest loans to farmers for agricultural work. So 3 years ago, a state representative introduced a bill to open up that existing agricultural loan program to corner stores, so that corner stores could apply for loans to improve their infrastructure and purchase and store fruits and vegetables and staple goods. Well, that bill was signed into law, and there's no assessment of this policy yet, but it's really an example of one creative way to use existing funding. It's leveraging that funding, which previously was only available to farmers and agricultural interests, to address another real problem: actual food retail and what's available for people to buy in the communities. A third area of financial sustainability is not really looking at whether there are existing funds to implement a program, but looking sort of at the back end. What happens when the program is successful, the policy is successful, and is there a savings of funds that can be directed to public health? 1988, California voters passed Prop 99, and shortly thereafter, the California legislature created a dedicated tobacco control program in the Department of Public Health, which focused on a number of different tobacco-related policies and programs, but it really started working on policy work with counties and cities across the state. And as I mentioned before, we've done a lot of work on local policies throughout California, and there are literally hundreds and hundreds of communities that have a youth access law locally, or a smoke-free outdoor air law, or an ordinance that restricts indoor smoking further, or multi-unit housing. So there's a lot of local policies in California, and a number of good state policies as well. So there's been evaluation of the first 15 years of the tobacco control program's work in California, and the results were really astounding. You can see here, $86 billion in saved healthcare costs for the state, almost 4 billion fewer packs of cigarettes sold, and tobacco-related diseases went down by 25% compared to the rest of the country. The results are outstanding, but I want to focus really on the first one, which is the cost savings. This really shows that you get a return on your investment for policy work. Another example of cost savings and return on investment comes from the city of Hernando, Mississippi. The city of Hernando and its mayor, Chip Johnson, have embarked over the last several years on a number of different public health policies, including facilitating farmers markets, linking local producers to those farmers markets, smoking ban, and promoting better sidewalks and bike lanes through complete streets. Well, just in the first few years of those efforts, the city of Fernando has already reaped financial benefits. The city's health premiums have been reduced, and it's allowed for a pay increase for city workers. You can see a quote here from Mayor Johnson that they've shaved 15% off their insurance costs and saved taxpayers money as a result. I think that these kind of results are very important for the sustainability of policies overall, because if you can show that these policies not only work to reduce chronic disease, but they also save money, it really is a win-win. The final aspect of financial sustainability is that your policy can actually generate revenue in order to pay for itself. And the primary policies in this category are taxes, fees, and licensing. I think we're all familiar with taxes, for better or for worse. Every state and the federal government has a cigarette tax, and now we've heard a lot of interest in enacting a similar tax on sugar-sweetened beverages. Well, taxes can be an effective public health policy unto themselves if they raise the price of the product and people stop consuming so much of it if it's a harmful product. But taxes can also generate a lot of revenue, obviously, and how you use that revenue is important for public health. We support taxes here at Public Health Law and Policy that are earmarked in the proceeds for public health prevention and treatment programs. Those taxes raise a lot of money, and since the taxes are on products that cause chronic disease and harm our health, that not only makes sense that the proceeds are directed to public health prevention and treatment, but it helps sustain the policies that improve our public health as well. Similarly with impact and regulatory fees, which are closely related to taxes. A tax can really be enacted on anything the government wants to enact a tax on, so long as the proper procedures are followed. But fees, impact fees and regulatory fees, are tied to certain business activities or development activities. And those fees are really designed to mitigate whatever impacts or harms are caused by those activities. So if you think that there is a harm by selling sugar-sweetened beverages, in many states it would be allowable to charge a fee instead of a tax on the businesses selling sugar-sweetened beverages to mitigate those harms. Impact fees are also very common on large developments that might cause environmental and public health impacts to mitigate those impacts. A separate type of regulatory fee is a license fee. A license fee is just a regulatory fee, but when I was talking earlier, and Catherine was talking earlier about tobacco retailer licensing programs and how successful they are and how it's important to have clear enforcement. Another great attribute of licensing programs is that you can charge a fee for the license to cover all of the costs of the enforcement and implementation. This has really been one of the keys to the success. You can't recover more than the enforcement and implementation costs. In other words, you can't make money, but you can charge the retailers whatever it actually costs to enforce the policy. And in this way, it really promotes fairness as well. If there is a problem with responsible retailing, who's really supposed to foot the bill for that problem? It makes a lot of sense that the retailers who have to be monitored are the ones who have to pay for it rather than the government. And oftentimes this is a huge selling point for licensing policies across California. At PHLP, we're also working on a licensing ordinance for healthy food retail, looking not just at tobacco retailers or not just at sugar-sweetened beverages, but at the retail environment in general, and requiring a license and setting conditions on that license to make sure that there's a certain amount of produce or staple foods or participation in SNAP or whatnot by the retailers to create overall healthier environments. And again, just like tobacco retailer licensing, since it's a license, then you can charge a licensing fee for this to cover some of the costs or all of the costs of implementation and enforcement. So these are some of the ways that you can ensure that your policies will be financially sustainable. And if you want to have the best chance of success and you don't have a huge pot of money for enforcement, it's really important to see if you can fit your proposed policy into one of these areas.
Element 7 is it changes the conversation. So in public health, we often hear that the solutions are really about personal responsibility or individual choices and behaviors. But what we really want to be talking about is how the environment influences those individual behaviors or choices. And a strong policy will start that conversation happening and get people talking. So tobacco control work has actually been changing the conversation for decades. When you think of smoke-free policies, a lot of them made it more likely for people to quit. And in this way, it was the environment not being able to smoke indoors that had an influence, a positive public health influence on people's individual behaviors. So a recent example of how tobacco control policies have been at the cutting edge of this is with smoke-free multi-unit housing. In 2007, Belmont in California was one of the first communities to consider this. And it actually happened as a response to an incident in a senior center where a cigarette caused a fire that was fueled by an oxygen tank. And one of the residents, really concerned, who was already affected by secondhand smoke, started contacting local council members. And this got a lot of people talking. And you can see from the headlines, smoking ban hits home truly and Big Brother butts in. Fox News was questioning, can the government ban smoking in your home? Well, the answer is yes, it can. And that's because it's not just about individual behaviors to smoke in your apartment building. We know now that smoking in your apartment can drift through vents and wall sockets and through the walls themselves, across patios and through open windows, and it really has negative health consequences on your neighbors. So since this ordinance took effect in Belmont in 2009, over a dozen communities in California have passed similar ordinances. And this is just one more example of how people have been talking not so much about individual behaviors, but how this affects a larger group of people and the changes to the environment we can make that will benefit public health. Another example is with restaurants marketing junk food with toys. So I think until recently, when we thought about fast food advertising, we would probably think of billboards or commercials. But in reality, the toy that comes in a lot of kids' meals is just another form of advertising or marketing. Santa Clara County in California wanted to do something about this. So they created a toy giveaway ordinance that basically required any kids' meal that came with a toy to meet certain nutritional criteria. So it didn't ban Happy Meals or ban toys, but what it did was say, if you want to use the toy as a marketing technique for a meal, then that meal has to meet certain nutritional criteria. So instead of a Coca-Cola, it should come with milk. Or instead of fries, it should come with apples. This, again, got a lot of attention from the media, and it got people talking about the incentive structure. So fast food restaurants with this new ordinance now had a reason to create healthy options that they didn't have before. And what this really does is it makes it easier for parents to choose healthy options if they want to, because now when they go into a restaurant, the healthy option exists, when beforehand there was an environment that didn't encourage healthy options, that actually fast food restaurants would make profits off of the unhealthy options. So this is just one more example of how policies like this that are really cutting edge will get people talking and thinking, and will really shift that conversation from individual choices to how can we change the environment to make those individual choices easier.
And that brings us to last but not least, element number 8. The policy should be part of a bigger plan. Let's take a look at and think about for a moment the tobacco control movement writ large in the United States. I think we would all agree again that it's been quite successful. There's work to be done, but tobacco control has been a successful public health movement in in the United States over several decades. But what has been the reason for that success? Has it been any one single program or policy? Not at all. Cessation services and other medical-based programs, quit lines, and numerous policies, taxes, smoke-free areas, youth access laws, have all worked together. And all of those programs and policies together, the bigger plan, is why we've had so much success in tobacco control. when starting to work on obesity prevention, and especially in listening in some of the city council hearings on some of the soda taxes and SSB taxes that have been considered around the country, one thing that I've heard over and over again is, do you really think that if we impose a tax on this soda, it's going to end obesity? No, I don't think that. But it's one arrow in the quiver, so to speak, of policies that will have a big effect. One of our consultants drew this for us here at PHLP during one of our retreats, and I really love this picture. It shows a view of a healthy community. And there's a lot there, I'll leave it up, but it really does underscore this point. There is no one policy that will work. You need better access to physical activity. You need areas for people to play. You need to be able to walk and bicycle. You need access to healthy foods like farmers markets. You need to restrict fast foods and junk foods if you can, restrict smoking. All of these go together into building a healthy community. So if anybody says, well, do you really expect this one policy to change everything? The answer is almost always no, because I don't know of any policy that really unto itself has that kind of effect. But every policy is large of a part of a larger plan and really should be marketed like that. So there you have it. Those are the 8 elements to a strong public health policy, and here they are again. Each one of these looks very simple, but is packed with a lot of information.
So as Ian said, that's a lot of information, and I wanted to bring you to some resources that would help you digest that. The first one is this 8 elements worksheet. So what this worksheet is actually something you can use when you're thinking of a specific policy goal. And it lists all 8 elements with some key questions that prompts you to think about whether your policy would meet that element or not. And this is available on our website where you're accessing the webinar. And I encourage you to use this not only when you're thinking about policies, but when you're working with partners to get them to think about these elements too. Especially some of the ones that they might not think of so commonly, like addressing disparities or having enough local data. Once you have a good idea of your policy goal, I really encourage you to go to the Public Health Law and Policy website, where we have a lot of resources that can be helpful to you in realizing that policy. So in addition to fact sheets and checklists, we also have model language, and this model language can be adapted to your community, and you can download it if you like, but we're also here available to provide technical assistance and help you customize the model to your own community. And while we do provide technical legal assistance, we can't provide legal advice and we can't provide legal representation. So I really encourage you to contact your city attorney or another licensed attorney in your jurisdiction if you have any questions about that. But as I said before, please feel free to contact us with any questions about the elements or anything else you heard in this webinar, the resources we have available, or if you'd like some technical assistance, we're here and this is our contact information. Thank you so much for listening to this webinar, and I hope it provides a benefit to you in your policy work in the future.
Thank you. Please stand by.